Hello. A common and distressing scenario that we encounter in veterinary practice is where pet owners, dog owners in particular, are compelled to consider euthanasia or rehoming because of bad behaviour in their dog. When I say bad behaviour, we are talking about three categories of behaviour where literally owners in this situation are caught between a rock and a hard place. The first category would be antisocial behaviour, such as breaking out of a yard, terrorising the neighbourhood, perhaps chasing cars on the road, that sort of thing, breaking out of the yard, barking during the day inappropriately. These sort of situations will result in people getting in trouble with their landlords, their neighbours, Gardaí may be involved, and so on. That's the first situation. Second situation will be a very obvious cut and dried situation, particularly in rural Ireland, that of sheep worrying, dogs chasing and even killing sheep in neighbouring fields. Again, Gardaí will usually be involved. There will be damage to property, i.e. sheep, and there will be some financial considerations and implications for the owners of these dogs. That's the second situation. And the third distressing situation where a dog owner may be compelled to consider either rehoming or more likely euthanasia would be in the case of a dog bite. That may be a bite of someone within the household, within the family, be it an adult or a child, or more serious still in many cases is if a neighbouring child or neighbour has been bitten by your dog. So these three situations will often result in customers coming to us for a consultation as regards what their options are. The reality is, by the time a situation of antisocial or aggressive or dangerous behaviour like this has escalated to the extent where they're seeking advice from a vet with regards to possible euthanasia, the reality is the situation has often gone too far. The reason why I say that is because remedial options are limited when a behaviour has already escalated. Remedial options to be considered in early stages would be, first of all, neutering or castration. This undoubtedly has a calming and an improving effect on the male dog, particularly in adolescence, but in order to see the improvement, to see the benefit, you need to be doing it at least before 2 years of age and ideally before 18 months. That's the first thing. Secondly, we do have medical options nowadays to help calm potentially aggressive dogs, badly behaved dogs. There's a medication on the market called Reconcile, which is primarily licensed for separation anxiety, but which does have some benefit for reduction of aggressive behaviours and reactive behaviours. However, this medication does take 1 to 2 months to begin working, and during that time then there's obviously the risk or the increased risk of repeat offences, repeat offending behaviours on behalf of the dog. And the third option to consider would be training, taking on board professional training. But the reality is that once these bad behaviours are already cemented into place, dogs being creatures of habit, it can be very, very, very difficult to break bad habits of behaviour. We always have to advise owners that there is no guilt, there is no blame in most of these cases on the owners, and oftentimes there's very little owners could have done to predict the escalation of these behaviours, as in many cases bad behaviours such as reactivity, separation anxiety, excessive barking and so on, many of these behavioural tendencies are cemented in place during the window of socialisation between the ages of 4 weeks and 12 weeks of age. In other words, in many cases, people are taking on a puppy where the seeds of future problem behaviours are already sown. So, as I say, as vets, the onus is on us in these situations to apply a no blame, no fault approach to trying to address the problems for owners and help them understand what their options are. The reality, however, is that if the Gardaí are already involved and there's a potential legal implication to the fact that your dog has bitten somebody, caused damage to property, or has been disrupting the neighbourhood, the reality is that your options are limited. Your options will be, as I say, neutering, which may not work, medical help, use of the reconcile and so on, which may not work, rehoming, but in the incidence of rehoming, legally you are compelled to fully disclose the behaviours and to take on board a level of responsibility in ensuring that the risks of future behaviours are managed properly. Which unfortunately brings us to the last option, where truly owners are caught between a rock and a hard place in having to consider euthanasia because of bad behaviours. Pet owners are brought to this scenario where euthanasia is being considered because of the obvious safety concerns to either themselves, a member of the family, or others in the neighbourhood. Unlike medical euthanasias, whereby we are putting to sleep an animal on humane grounds to prevent suffering or to protect its quality of life, in the scenario whereby we're looking at dog behaviour, we have to consider social and legal concerns. So it's a whole category of conversation. In order to help us to have this conversation with pet owners, we apply four criteria of risk assessment. The first criteria of risk assessment is to consider the animal's size. For instance, in the case of restricted dog breeds, the XL Bullies, Rottweilers, German Shepherds, Belgian Malinois, and so on, these dogs are big and powerful. So if a dog's behaviour has started to become uncontrollable or unpredictable, the animal's size and strength, and for instance the strength of its bite, that is the single biggest criteria that affects the level of risk in this situation. The second category by which we look at the level of risk on a risk assessment basis is the bite history. Was it a one-off? Was there a particular trigger? Is there any excuse for it? In other words, what is the complete bite history? Has there been more than one or two occasions? Has the dog been building up to it? Have there been incidents of a couple of smaller snaps and bites, perhaps to a variety of different people? And has it finally resulted in a damaging, a nasty situation whereby one bite has resulted in maybe legal involvement and serious concerns? So bite history, the second criteria of risk assessment. The third criteria of risk assessment is the issue of predictability. How can you predict if and when your dog will bite, if and when your dog's behaviour will break out? And with the predictability, is there then some type of prevention or manageability that you can put into place? Bringing me to the fourth criteria, which is the manageability part. For instance, does it only happen when your dog breaks out of the yard? Can you improve the fencing? Can you put dog daycare facilities in place whereby the dog's behaviour can be managed and controlled? If it's a thing that you're in trouble with your landlord, can you move or are you going to move? So these would be the four categories of risk assessment: the size of the animal, the bite history, the predictability of the bad behaviour, and the manageability of the bad behaviour. Can you manage the dog's environment to prevent these incidents from happening again? Now, if these four criteria are outside of your control and you can't put measures in place, then again, on a no blame, no fault basis, euthanasia probably, unfortunately, should be your first choice. And the reason why, as I say, we would be pushing you towards that criteria, towards that decision, if your dog fails, as it were, the four categories, simply is because the window of socialisation in these dogs is very narrow. It's 4 weeks to 12 weeks. Nowadays, particularly in the aftermath of COVID, we found that people have taken on dogs with habits and behaviours cemented in place, which no dog trainer or no vet can help you remedy. So it is important to remember that by the time a situation of bad behaviour has escalated, it's probably already too late. And your primary concern should be the safety of your own family, the legal implications of the situation, and ensuring that you can restore harmony and safety and calm to your own household, albeit sadly in the absence of a dog, of the dog in question perhaps. Owners of these dogs whose behaviour has escalated to the involvement of police at this stage are indeed caught between a rock and a hard place, because increasingly the issue of legal liability for dog misbehaviour is coming to the forefront of society. Increasingly, rescue agencies, adoption agencies will be reluctant to take on dogs with problem behaviours simply because they cannot rehome out these dogs without full disclosure, and they are responsible for the dog's future behaviours, and they are responsible for the safe rehoming into an acceptable environment of these dogs. So it's a lot for both the former owners and the rescue agencies to take on. Oftentimes as vets we have the difficult task of informing people about the risk assessment factors on the basis of the animal's size, the animal's bite history, the manageability of that dog's future behaviours, and the predictability of that dog's future behaviours. And if we have any doubts with regards to these 4 criteria, unfortunately we do have to recommend euthanasia. If you like this video, please like and share. Follow me on Spotify at Pets Life, and I hope this has been helpful, albeit a difficult topic.